much more.
Are you ready, kids?
Aye, aye, Captain!
I can't hear you.
Aye, aye, Captain!
Oh!
Fucking design on right now.
Break it down, bring it back, make it clap. I got 3 old thoughts, new block, wear that thing. Bitches on my line.
Hello everyone, let me introduce myself. My name is Dewi Santika Simanjunta from the Public Health Science Study Program from Everina University. Have you ever heard of tetanus? It may sound foreign to some people, but actually this disease is closer to us than we think. For example, someone is scarred by a rusty nail or even bitten by a pet. For trivial incidents like this, tetanus can occur. Well, this is time I will explain more about tetanus. Enjoy watching! What exactly is tetanus? Tetanus is a serious disease caused by the bacteria Clostridium tetani which produces toxins. This toxin attacks the nervous system and causes severe and painful muscle spasms. These bacteria usually enter the body through contaminated wounds, especially puncture wounds or dirty wounds. So, what are the symptoms of tetanus? Tetanus symptoms can vary, but the most common include 1. Stiffness in the jaw muscle or lockjaw. 2. Stiffness in the neck muscle. 3. Difficulty swallowing. 4. Painful muscle spasms. 5. Fever and excessive sweating. 6. Increased heart rate and blood pressure. These symptoms usually appear 3 to 21 days after the bacteria enter the body, but can also be faster or slower. What are the consequences if tetanus is not treated immediately? Tetanus is a very dangerous condition. If not treated acutely and properly, it can cause serious complications such as fracture due to seizures, respiratory problems, anemia, and even death. Imagine, for a small trivial wound, it can lead to a fatal condition if there is not proper treatment. But the good news, tetanus can be prevented. This issue, we just need to remember the prevention of vaccine. V. Complete tetanus vaccination. Make sure to get complete tetanus immunization according to schedule, both for children and adults. This vaccination is very effective in preventing tetanus. Pregnant women also need to get TT or tetanus toxin immunization to protect themselves and their babies from neonatal tetanus. A. Anticipate wound and clean immediately. Always be careful when doing activities that have the potential to cause puncture wounds or open wounds. If a wound occurs, immediately clean it with running water and soap. Remove dirt or foreign object that sticks to the wound. Disinfect the wounds with an anticipation as rubbing down in iodine. K. Consult a doctor for high-risk wounds. If the wound is deep, dirty, or exposed to rusty objects, immediately consult a doctor or the nearest health facility. The doctor may give a tetanus immunoglobulin or tick injection or a tetanus vaccine booster if necessary. S. Always maintain personal and environmental hygiene. Although not directly related to tetanus, maintaining personal and environmental hygiene can reduce the risk of infection in general. E. Information and education. Let us remind each other the spirit in protect information about tetanus, because prevention is much better than cure. certainly safe and healthy. By taking the preventive step above, we and other family will certainly avoid tetanus. Don't wait for accident to get tetanus before we panic. It's better to prevent it early, right? Let's create a healthy and intelligent generation that is free from tetanus. Remember, healthy, good future. That's all I can say about tetanus. If there are any mistakes in my words, I apologize. Thank you for watching.